My name is Kevin Camacho, and I'm going to be speaking about mastitis. Mastitis is the inflammation of breast tissue. This disease process can be with or without an underlying infection of the breast tissue. So I drew out here, or what I drew out here is a breast, and I showed the milk duct inside of this drawing, and one of them is inflamed. The one that's red is going to be what's depicting the mastitis. So the population who's at risk for mastitis are women who have had mastitis in the past, and then women with cracked nipples due to breastfeeding or whatnot, and then women who wear tight-fitting bras or something that can restrict the the flow of breast milk. So some of the signs and symptoms of mastitis are tenderness, warmth to the touch, breast swelling, pain or burning consistently while breastfeeding, and a fever of 101 or greater. Some complications of mastitis can include an abscess if it's left untreated, and the diagnosis of mastitis is done via physical examination. This is the most common diagnostic for this disease process because it can be easily identified. The incidence rate of mastitis is about 20% of women who breastfeed, and that's the incidence rate in developed countries. So some of the possible nursing diagnoses are acute pain related to the inflammation of breast tissue, and another one is risk for ineffective breastfeeding related to milk flow interruption due to inflammation. The medical management for mastitis is a 10-day course of antibiotics to treat the possible infection and pain relievers that are in the non-steroidal anti-inflammatory drug class. There is a potential surgical management for this if it progresses to an abscess. Then surgical drainage may be indicated for this. And some of the nursing implications or interventions are to teach the patient to utilize a warm compress, assess the breastfeeding for proper latching, instruct the patient to wear a proper fitting bra, also instruct the patient to ensure complete drainage when feeding on the affected breast, and additionally instruct the patient to start feedings on the affected breast to promote complete emptying.